As of today, we have 27,000 cases of COVID-19 that have been diagnosed since the beginning. 249 people are hospitalized, and sadly, 235 people have died from COVID in San Francisco. We are now almost 3 weeks past Christmas and nearly 2 weeks from New Year's, and we are still seeing a post-holiday surge in our COVID cases. Dr. Colfax will go through the numbers, but a few things to note. While our cases are still higher than ever, the rate of increase isn't as severe as we saw after Thanksgiving. This is some good news, and it means hopefully that people are following the health orders. However, we started this holiday at a more precarious point, so even a slower rate of increase is seriously concerning. Our cases and hospitalizations remain dangerously high, and our infection rate is still above 1. The Bay Area as a whole, like pretty much the entire state, remains in a very difficult position. Yes, the vaccine continues to roll out, but we aren't yet able to see the curve flattening. That means right now, we need to focus on 3 basic things we can do: continuing to stay at home and limit our interactions as much as possible to stop the spread, supporting the vaccine rollout, and finding ways to help those that are struggling, including our small businesses. We know there has been good news recently for small businesses from the federal relief package and the extension of the PPP loans. And with the state's recently announced small business COVID-19 relief grants, there is hope. But there's so much more we need to do. That's why I asked my budget staff to go to departments and find any ways to cut costs, to reprioritize funding, to support our small businesses. And the good news is we found some. Today, we are unveiling a new plan that will provide significant relief for our small businesses, mostly impacted by COVID. This new plan will include a mix of $62 million in grants and loans that will be available for businesses most impacted by COVID. These are businesses who have not been able to open their doors or have been severely limited in the services they can provide. We're talking about our restaurants, our nail salons, our bars, our nightlife venues, our gyms. This new plan will more than triple the amount of local support we have provided in grants and loans so far during this pandemic. Let's start with the direct grants. The SF Relief Program will provide $12.4 million in grants ranging from $5,000 to $20,000 per business. While we want to support our small businesses, we especially want to target those businesses that are located in high-need neighborhoods, that are operated by those who have had less success accessing existing programs, like businesses owned by women and people of color, those that have been most impacted by the stay-at-home orders, and those that are unable to access federal programs. Our goal is for these grants to come quickly, starting in February, to provide immediate relief for our small businesses who so badly need it. Next will come our proposed loan program. The focus here will be longer-term support, especially for those businesses that have been left out of our existing relief programs. Our plan is to provide up to $50 million in low interest and zero interest loans of up to $250,000 each. And while we need to focus on supporting all of our small businesses, part of this plan will focus on supporting what we call our anchor community businesses. These are small businesses with slightly higher revenues that are often left out of our small business relief plans. This includes many of our restaurants, which of course are such an important part of what makes our city special. But they also employ more people than many other small businesses. That's an important point because when we talk about relief, this isn't just about saving our small businesses, but it's also about keeping people working. We will also have a microloan program that will support very small businesses who may not otherwise be in a position to borrow money. These loans will come after the grants, and they will help stabilize our small businesses through the challenging months ahead. As I said, this new $62 million plan will triple what we've done so far. Our previous efforts include $29 million in grants, loans, and fee waivers. In addition to grants and loans, we've also provided through programs like Great Plates, which pays local restaurants to provide meals to those in need. We've also launched our Jobs Now program, which will help pay a portion of staff wages so that businesses can hire people as they start to reopen. And of course, we are continuing to do the work to streamline the process for getting permits to open businesses in San Francisco. We're implementing Prop H, approved by the voters this past November, which requires the city to grant permits to new businesses within 30 days. This streamlined process will be essential as we begin to reopen our economy in the months ahead. We have to make it easier to open and operate businesses in our city. For more information about all the support we are providing, go to oewd.org/COVID-19. Supporting these businesses is so critical as we work to flatten the curve and get people vaccinated. Now, I know everyone is anxious about the vaccine, not just because I want everyone to be protected from this virus, but also because I know what it means for the future of our city. We all want to open and get back to normal. It means that we can start to move San Francisco forward and be around one another again without the fear of spreading the virus. I'm looking forward to the days when we can walk down the street and see each other without a mask on, when we can go to a Warriors game or to a concert or a play or anything that is available where we can gather or just go hang out with our friends. Really, when you think about it, we never knew how good we had it. Now, I know a lot of people have questions about the vaccine. When is it my turn? When do I get my turn? When is it going to happen for me? And when we're going to get the city back open? When can I open my business? When can I send my kids back to school? Especially when can I send my kids back to school? Because I know most parents have probably had it up to here. Now that we are on this, first and foremost, we are following the state guidelines on how the vaccines are distributed to who, and we are working to get people vaccinated as quickly as possible. While the state has set up the distribution of the vaccine so most people will get vaccinated by their healthcare providers, we're working with our healthcare partners and pharmacies on ways to scale up vaccine delivery. This is an all hands on deck moment, and we all have a role to play. Dr. Colfax will go into a little more detail on this, but know that the city is working to identify sites to set up for vaccinations. But it can't just be about one large, massive site. One lesson we learned from our testing system was that we need to work with our community partners and meet our most impacted communities where they are. We have to build trust with these communities to ensure that they are getting the care they need. That's the kind of thought we have put into how we reach people as this rollout continues. We also know that in our country and our city, too many people still remain uninsured. DPH is, in addition to vaccinating workers and residents at city-run facilities like SF General and Laguna Honda Hospital, they will continue to fill the gaps for those who won't be vaccinated by a private provider. That means people who are homeless, uninsured, and undocumented, the people that DPH has provided healthcare to for years, will be able to get vaccinated through our city resources. Once we actually have more vaccines and we can move into the next phases where we start to see these individuals eligible, we will have systems in place to get them vaccinated as quickly as possible. Rolling out this vaccine is a big deal, and it's complicated, but we will work with our healthcare providers and our community partners to reach people as best we can. To the people of San Francisco, I know it's been hard, but I thank all of you for everything that you continue to do. There is, and I know you hear this very often, there's a light at the end of the tunnel, but there really is. there's just a lot of sacrifice that we're going to have to make in order to get there between now and getting out of that tunnel. Now, I'm going to turn it over to Dr. Grant Colfax, who's going to provide us with an update on the numbers and what we're seeing out there and the latest information around the vaccine. Dr. Colfax.
Thank you, Mayor Bree, and good morning, everybody. Thank you for your time and attention. First, I want to start out with a note of appreciation today before I provide an update on the numbers, the COVID-19 numbers in San Francisco. As you hear these numbers, especially when we talk about the number of patients in the hospital, please remember, each one of those patients has multiple dedicated healthcare professionals providing their care. From the people who make the meals, to the technicians providing the tests and x-rays, to the nurses and doctors at the bedside, San Franciscans are in good hands. And healthcare workers are shouldering a tremendous burden for our city and our communities right now. As our post-New Year's cases surge, on top of our post-December holiday cases, on top of our post-Thanksgiving cases, these healthcare professionals are showing up every day, ready to meet the mounting challenge. They are as skilled as they are compassionate. They are incredibly dedicated. And we often say they are, quote, tireless, but I know that they do get tired. Faced with a relentless virus, they are doing their very best. My gratitude to them is deeper than I can express in any words. And if you know any of these hardworking people, please take a moment to thank them. And please keep doing the things that protect them from infection. Let's not put them in the position of so many of their colleagues across the country where hospitals are overwhelmed. Please, for their sake, for your sake, for our community's sake, cover your nose and mouth when you go out. Wash your hands, keep your distance from others. Please do not gather with people outside of your household. And if you are sick, of course, stay home. Our healthcare workers, thank you for doing your part so that they can do theirs. And now let's look at the numbers. First slide, please. As you might remember, last week, we said it would take until mid-January to get a fuller picture of the impact of the December holidays. What we are seeing now is a holiday surge on top of an even larger Thanksgiving surge. We are in a dynamic situation where the cases are rising in a post-December holiday surge above an already record-setting surge after Thanksgiving. As this slide shows, post-Thanksgiving, we saw about a 70% increase in cases in the weeks following that holiday. Now, we've seen about a 28% increase in our post-December holiday surge. We are now averaging the same new cases per day we saw during the post-Thanksgiving surge. And San Francisco is currently averaging about 280 new cases every day. Next slide. And as our cases continue to increase, you can see that our number of hospitalized patients with COVID-19 across the city continue to increase. We have, as of yesterday, 249 COVID-19 patients in San Francisco hospitals. For comparison, during the last surge in July, we topped out at 114 patients, fewer than half of what we are seeing today. And of course, this local surge is happening amid a regional and state and national hospital surge. Now, while San Francisco, thankfully, still has enough ICU capacity to treat our patients, The surrounding counties' ICU bed availability continues to shrink. Our own history tells us that so far, San Francisco can successfully manage surges such as this. But we must continue to work to flatten this curve. We need to turn this around. The current trajectory is not sustainable. By working together, taking precautions, and making hard sacrifices, we have saved so many lives, and we can continue to do so again. And now we have another tool to help push our hospitalizations down and to flatten the curve. Vaccines coupled with those prevention measures. There's been a lot of news and a lot of discussion and some controversy about the rollout of vaccines. And it is complicated, but it is happening. And believe me, we are working hard with partners across the city to get as many vaccines into as many arms as possible. Many of the decisions regarding allocation of vaccine are being driven by the state and federal governments, including the amount of vaccine a county will receive, and when, and how. The state has developed the distribution plan for the vaccine. Under the distribution plan, vaccine is shipped directly to healthcare providers, such as Kaiser, CPMC Sutter, and others. It includes the Department of Public Health, which, as you know, is a healthcare provider in the city. The state is prioritizing populations for the vaccine because the initial supply of the vaccine is limited. The first phase of distribution, known as Phase 1A, prioritizes workers in healthcare settings most likely to be exposed to the virus or transmit the virus. The majority of these workers are being vaccinated here in San Francisco by their employer, whether it be Kaiser, Sutter, UCSF, or here at the health department. Phase 1A also includes vaccinating residents of skilled nursing facilities, where residents are at particular high risk for complications of COVID-19 and from dying from COVID-19. And I have some really good news to share with regard to vaccination in skilled nursing facilities in our city. All residents of Laguna Honda Hospital, the largest skilled nursing facility in the country, have been offered a first dose of vaccine. And across the city, 13 of the 18 skilled nursing facilities have had their residents offered vaccine through the federal pharmacy program for long-term care. The remainder skilled nursing facilities are expected to be completed this week. In the meantime, we are working with the city's healthcare providers and pharmacies to scale up vaccine delivery. Because the federal and state governments are distributing vaccine directly to healthcare providers, these partnerships will be absolutely key to our success as a city. COVID Command Center is working with healthcare providers to stand up large vaccination sites where providers can efficiently and effectively serve their patients. In partnership with the health department, the city's COVID Command Center and Department of Emergency Management Director, Mary Ellen Carroll, is identifying civic facilities across the city, including specifically in neighborhoods with the most highly impacted and vulnerable communities that can serve as high volume vaccination sites for our healthcare providers. We are working to ensure that vulnerable populations and that those who do not have access to private healthcare, as well as those who are in the most impacted community, are prioritized for vaccine. One key mission of DPH, the health department, is to serve those that do not have access to private healthcare systems. This is the focus of our city's community clinics. The health department serves as a safety net, providing services through the San Francisco Health Network and other programs for those uninsured or underinsured. DPH is working to ensure these populations, as well as the most highly impacted by the virus, receive the vaccine as efficiently as possible. This will be done by bringing the vaccine directly to vulnerable populations and those most impacted by the virus through our health department's community clinics and other community-based sites that will provide access to vaccine. For instance, we are partnering with community organizations such as the Latino Task Force and with UCSF to offer vaccines at community sites in neighborhoods with the highest COVID-19 prevalence to ensure access to vaccine with the highest COVID-19 prevalence among workers and those who may not have access to healthcare. Now, over 95% of San Franciscans are covered by some form of private or public healthcare providers. That is why our partnerships with major healthcare providers are so important for distribution of vaccine. The remainder of San Franciscans are enrolled in Medicare, Medi-Cal, Healthy San Francisco, or other city-run programs. And some people have no coverage at all. These are the most vulnerable to COVID-19. The health department will ensure these populations are offered vaccine. For instance, as of this week, within our San Francisco Health Network, our clinical care system of the health department, people 65 years of age and older will begin to be offered vaccine. Among the San Francisco population, people 65 years of age and up only account for 15% of COVID-19 cases, but they account for over 80% of San Francisco's COVID deaths and nearly half of our hospitalizations. We are working to ensure this group has access to vaccine as quickly as possible. And we will start offering vaccine to these patients at Zuckerberg San Francisco Hospital, Southeast Health Center, Maxine Hall, and our COVID Command Center clinic this week. Getting these shots in the arm will save lives. Our goal at the health department is to ensure that vaccines are safely provided to as many people as possible, as quickly as possible, and as equitably as possible. And this is an unprecedented undertaking, the mass vaccination of the entire nation to end the pandemic. As vaccine supply increases, more people will get the vaccine, including younger people and people at lower risk for complications from COVID-19. Most people will get the vaccine from their healthcare provider or insurance provider going forward, and hopefully later this year. Until then, and for now, even after you are vaccinated, we must all continue to take the precautions we know so well. Wearing the mask over your face, over your nose and your mouth, washing your hands, physically distancing, avoiding those mass gatherings. Remember how much it helps those hospital workers when you stay at home and avoid gathering with others outside of your household. Remember how it will save lives of our most vulnerable neighbors and loved ones. Remember that you are making a difference every day, even when sometimes during this pandemic, things do seem a little bit out of control. One day, we will remember this massive efforts and the pandemic will be behind us. That will be a day for mass celebration. And for everything you are doing until that day, I thank you.
Thank you, Mayor Breed and Dr. Colfax for your remarks. Before we begin the question and answer portion, we're going to take a moment to allow reporters to submit questions on WebEx. Thank you for your patience. Thank you for your patience. When you're ready to begin, Director, we will start.
I'm ready, thank you.
Your first question comes from multiple media outlets. Will San Francisco open up mass vaccination sites like San Mateo County does?
Yeah, so we are getting vaccine into arms as quickly as possible. When we have a sufficient supply of vaccine to meet the need for a mass vaccination site, we expect to have that site up and running. Our goal is to open such sites as fast as possible when the state supplies us with more vaccine. We really need to get more doses and move through the different phases of the state levels in order to accomplish the goal of a vaccine site, which is obviously to get many, many people vaccinated as quickly as possible. Director Carroll, in partnership with healthcare providers across the city, assures me that high throughput sites will be available in match with the supply of vaccine that we expect to be coming soon. So we are we are planning, and we expect these to be on the ground soon, and certainly in time for us to ensure that people who become eligible for the vaccine have a place to get it through their healthcare provider. And if they don't have a healthcare provider, that there's also access for people who meet the state criteria to get the vaccine at that site as well.
Thank you, Dr. Colfax. The next question comes from Christian Kaftan, KTVU Channel 2 News. How will San Francisco residents know when, where, and how to receive vaccinations? Will there be an online registration or text or email from the city notifying them of the time and location to receive their shots?
So since the majority of people will be receiving their vaccine from their provider, they will receive a notification from that provider when and how vaccine is available. For those that do not have a private provider, we are going to be working obviously within our healthcare system to notify patients within our DPH community clinics when vaccine is available, and to provide them with appointments as expeditiously as possible. And we will continue to do the community outreach and partner with community leaders to ensure that people who may not access healthcare systems have access to vaccine through various vaccine clinics that, again, we expect to scale soon and commensurate with our vaccine supply. We'll also be working with business partners, other social media and other platforms to make sure that people know that vaccines are safe, and encourage people to learn about the vaccine and to get the vaccine when it is offered.
Thank you. Your next question comes from Ron Lynn of the Los Angeles Times. We know that in other counties in California, ambulances are enduring wait times up to 7 hours or more to drop patients off at the hospital. And hospital morgues have exceeded capacity, and emergency rooms are forced to turn away ambulances. Is San Francisco seeing any of these problems? And if not, why?
Well, I think we are seeing certainly a serious surge. And as you saw in the data, our surge now is twice. We have twice as many people in the hospital than we did during the summer. And again, as you see, our cases continue to increase. So we are certainly going to continue to experience high hospitalization rates among COVID-19 patients. Thankfully, our hospital capacity, including our intensive care unit capacity, is still reasonable. So we are not close to running out of hospital beds right now. But remember how quickly this virus can continue to spread, and how quickly it can get out of control even further. So we have avoided the worst compared to some of our fellow Californian jurisdictions, but certainly we want to continue to be as careful as possible to prevent further spread and to prevent overwhelming our healthcare systems.
Thank you. The next question comes from Heather Knight of the San Francisco Chronicle. When do you anticipate the city being able to loosen its current restrictions?
Well, our numbers are still going up, and it usually takes a couple of weeks for those numbers to start going down once they level off. Right now, we are under the state shelter in place order, and I expect we will continue to be in that until at least the end of this month. And really, we're going to have to watch the numbers to see if cases and hospitalization rates start to come down, and then we will have a much better sense of when we will be able to gradually reopen. Vaccine distribution and uptake will also be a factor in that, and obviously we are hopeful that the feds will provide the state with sufficient vaccine. We can get that out into arms, and that will also move us closer to a reopening. But until we get everybody access to the vaccine, which is many months away, we're all going to have to continue to practice those other prevention measures.
Thank you, Dr. Colfax. We will wait just a minute more to field additional questions. So thank you for your patience. Thank you. There are no additional questions. This concludes today's press conference. Thank you, Mayor Breed, Dr. Colfax, for your time. For future questions, please email dempress@sfgov.org. Thank you and have a nice day.